Welcome to our webinar. In British Columbia, the public health insurance is referred to as the Medical Service Plan, MSP. This webinar aims to offer you a comprehensive overview of MSP, enhancing your preparedness for life in British Columbia. During this webinar, I will cover the following topics: eligibility and enrollment to Medical Service Plan. You will learn about benefits, what services are covered and not covered by MSP, including BC PharmaCare and BC Healthy Kids program. Then you'll discover what is a personal health identification, what is BC Services Card, how to request it, and why do you need it. Additionally, we will explore the importance of managing your MSP account. Then you will find out what is the best way to contact the Health Insurance BC. And finally, you will gain insight into HealthLink BC and how it can help you in navigating health services. On the upcoming slides, you will discover the specific eligibility criteria for MSP in British Columbia. Under the Medicare Protection Act, enrollment with MSP is mandatory for all eligible residents and their dependents. A person must be a BC resident to qualify for medical coverage under MSP. A resident is a person who meets all of the following conditions: a citizen of Canada or lawfully admitted to Canada for permanent residence, make their home in BC, physically present in BC at least 6 months in a calendar year. Eligible BC residents who are outside BC for vacation purposes only are allowed a total absence of up to 7 months in a calendar year. Dependents of MSP beneficiaries are also eligible for coverage if they are BC residents as set out above. It is important to understand the meaning of dependent. Dependents include a spouse, children, and dependent post-secondary students. Spouse is a resident of BC who is married to or is living and cohabiting in a marriage-like relationship with the applicant. Child is a resident of BC who meets all of the following conditions: is a child of a beneficiary or a person who stands in place of a parent, who is a minor, doesn't have a spouse, is supported by the beneficiary. Dependent post-secondary student is a resident of BC who meets all of the following conditions: older than 18 and younger than 25 years of age, in full-time attendance at a recognized post-secondary institution, supported by beneficiary who is the person's parent who stands in place of the person's parent. For more information, please visit Eligibility for MSP Province of British Columbia website. Here is a list of residents who are also eligible for MSP. First Nations residents. The First Nations Health Authority enrolls and administers MSP to all status Indians who are residents of BC. Study and work permit holders, spouses and children of Canadian Armed Forces members, arriving under Canada-Ukraine authorization for emergency travel. To determine your eligibility and find out more details, please visit the government website section, Eligibility for MSP. On the upcoming slide, you will uncover the reason for enrolling in MSP, the process of applying for MSP, and what happens after you submit your application. All people residing in BC must enroll in the Medical Service Plan. This makes sure you can access provincial health care benefits like visits to a doctor. Coverage wait period. New and returning residents are required to complete a wait period consisting of the balance of the month in which resident in BC is established plus 2 months before benefits can begin. In total, 3 months of wait period. You should apply for MSP coverage immediately after arriving in BC rather than at the end of the wait period to allow time for your application to be processed. When a family moves to BC from within Canada and the applicant and spouse arrive separately, each person has their own wait period based on their arrival dates in BC. Coverage during the wait period. New residents from other parts of Canada should maintain coverage with their former medical plan during the wait period. New and returning residents arriving from outside Canada should contact a private insurance company for coverage during this period. Emergency medical care. A person can receive required medical and hospital services in BC before qualifying for provincial benefits. However, the entire cost of such services is payable by the person unless other arrangements for healthcare insurance have been made. As costs may be very high, those who plan to move to BC from outside Canada are strongly recommended to make arrangements for health insurance through a private company before arrival, and to maintain that insurance until provincial benefits are available. There are three ways to apply for MSP: online, by mail, and in person. Applying online is the easiest and fastest way to enroll. It takes about 15 minutes to complete. Before you start, make sure that you use the latest version of Firefox, Chrome, or Safari. You have identification for everyone on your application. You will be asked to upload digital images of documents that support the name and Canadian citizenship or immigration status for all persons. You have your marriage certificate, divorce decree, or legal name change certificate if your current legal name doesn't match the name on your ID. Apply by mail using a paper application form that you can download from the website and mail the completed application form to the address provided. You can apply in person at any Service BC location. Find the closest to your location and double-check its working hours. It is better to arrive early as there may be a waiting line. At the following slides, you will learn about healthcare benefits of MSP, including services provided by physicians and other healthcare practitioners. Services covered by MSP. MSP is the provincial insurance program that pays for required medical services. These include medically necessary services provided by physicians and midwives, dental and oral surgery performed in a hospital, eye examinations if medically required, and some orthodontic services. In addition, MSP pay for diagnostic services, including X-rays. For information on laboratory services benefits, please visit Laboratory Services website. Other services that may be covered by MSP include supplementary benefits. Supplementary benefits are different from medical benefits and provided by healthcare practitioners other than physicians or midwives. These include acupuncture, chiropractic, massage therapy, naturopathy, physical therapy, and non-surgical podiatry. Learn about the range of supplementary healthcare benefits covered under MSP for eligible individuals at GovBC website section Supplementary Healthcare Benefits. Medical benefits outside of BC. If you are eligible for coverage while temporarily absent from BC, MSP will help pay for unexpected medical services, provided the services are medically required, rendered by a licensed physician, and normally insured by MSP. There is important information you need to know about the extent of coverage while you are away from BC. Find out more information about MSP coverage in the other parts of Canada and MSP coverage when outside of the country at the section Medical Benefits Outside of BC, Government of BC website. Travel Assistance Program. BC residents who are required to travel outside their home community to obtain non-emergency, physician-referred specialist medical care may be eligible to receive assistance to help with the cost of travel. Learn more about this program at the section Travel Assistance Program at the Government of BC website. Services not covered by the Medical Service Plan. MSP doesn't provide coverage for the following services that are deemed to be not medically required, such as cosmetic surgery, dental services except as outlined under benefits, routine eye examination for persons 19 to 64 years of age, eyeglasses, hearing aids, and other equipment or appliances, prescription drugs, acupuncture, chiropractic, massage therapy, naturopathy, physical therapy, and non-surgical podiatry services, except for MSP beneficiaries receiving supplementary benefits. Preventive services and screening tests not supported by evidence of medical effectiveness. Services of counselors or psychologists. Medical examination, certificates or tests required for driving a motor vehicle, employment, life insurance, school or university, recreational and sporting activities, immigration purposes. Note that the Ministry of Health provides funding through the regional health authorities for hospital programs, mental health and addiction services, and residential assisted living. For information about ambulance services, see BC Ambulance Service page. For information about assistance with prescription drug costs, go to Pharmacare page at the Government BC website. The upcoming slides will cover what BC Pharmacare is and how you can take advantage from its benefits. BC Pharmacare is a program administered by the Government of BC that helps residents with the cost of eligible prescription drugs and certain medical supplies. It aims to ensure that all eligible residents have access to necessary medications while managing healthcare costs. Pharmacare has 12 plans that help BC residents pay for prescription medications, medical devices, and supplies and pharmacy services. One person can be covered by several plans. For most plans, you must be enrolled in the MSP. People who live in BC can get help from BC Pharmacare to pay for many prescription drugs, some medical devices and supplies, and pharmacy services. Get covered. All BC residents can register for the Fair Pharmacare plan. The plan is based on income. The less a family earns, the more help they get. What BC Pharmacare covers? Pharmacies charge different amounts for drugs and services. You may want to compare prices and services. Pharmacare covers most drugs prescribed by a physician, dentist, midwife, nurse practitioner, optometrist, or podiatrist licensed and practicing in BC. Read about all 12 Pharmacare plans, what BC Pharmacare covers and not, and search the drug list at the BC government official website. Don't forget to ask your pharmacist or physician if they can prescribe or adapt your prescription to a drug that Pharmacare covers. On the following slide, you will discover information about the BC Healthy Kids program and its general details. The Healthy Kids program is a provincial government initiative that provides coverage for basic dental treatment, prescription eyewear, and hearing assistance to children in low-income families who are not in receipt of income assistance, disability assistance, or hardship assistance. Eligible clients include children under 19 years of age who have coverage for MSP supplementary benefits through the Ministry of Health. How to apply for BC Healthy Kids program. Families who have been approved for MSP supplementary benefits will be signed up with the Healthy Kids program. Your family must have an annual adjusted net income of 42,000 Canadian dollars or less to be eligible for these benefits. To access MSP supplementary benefits, you must apply for MSP supplementary benefits with Health Insurance BC, file your taxes each year with Canada Revenue Agency, update your MSP account if you have any changes in your family. Health Insurance BC will verify your income each year with the CRA to determine ongoing eligibility for MSP supplementary benefits and the Healthy Kids program. No additional application form is needed to register for the Healthy Kids program. Coverage begins at the start of the next month following approval. It's important to know that before any services begin, check with your provider to see if there will be additional charges to you over what the BC Healthy Kids program will cover. For more information, please visit the section BC Healthy Kids at Government BC website. On the upcoming slide, you'll discover the significance of personal health identification, the purpose of the BC service card, how to obtain it, and its importance. Personal health identification. Each BC resident enrolled with the Medical Service Plan is given a unique lifetime identifier for health care called a Personal Health Number, PHN. Your PHN remains the same regardless of any changes to personal status and can be found on your BC Services card. You should carry your card at all times to have it available to be presented whenever you need healthcare services. The BC Services card is the government-issued identification card in British Columbia that combines your provincial healthcare number, photo identification, and other identifying information into one card. It is issued to access healthcare services, and it may also be required for other government services and programs. To request your Photo BC Services card, most adults need to visit a BC driver licensing office. To ensure the best possible service, book an appointment at your desired driver licensing office. Otherwise, check for available walk-in hours. For more information, please visit icbc.com appointment. At the ICBC driver licensing office, you will need to provide two pieces of identification, one of which must be primary ID. This is icbc.com accepted ID for more information. Declare that you are a BC resident and have your photo taken. Individuals on your account under 18 years and 6 months of age will automatically receive a non-photo BC services card in the mail from Health Insurance BC. If you have temporary immigration status, please contact HIBC. If you are 75 years of age or older and unable to visit an ICBC driver licensing office, you may request a non-photo BC services card. Your card is also used to obtain pharmacare prescription drug benefits. Adult MSP beneficiaries are expected to renew enrollment by the card expiry date specified on their BC Services card. Please visit govbc.ca BC Services card for more information. The following slide will help in comprehending the significance of managing your MSP account. Ensuring your MSP account is kept current is very important, as certain changes could potentially impact your coverage. MSP account changes may now be requested online to Health Insurance BC. The MSP account change request form allows MSP account holders to request changes and submit supporting documentation to update your address in BC, update or correct personal information for the account holder or other individuals on your account, add or remove a spouse or children, and update or confirm your status in Canada. The online form takes about 15 minutes to complete. No login or password is required. The account holder's personal health number will be used to verify your account. Before you start, make sure that you have documentation to support the requested change. To see supporting documentation that may be required, please go to MSP account change page at govbc.ca. Once the form has been submitted, a reference number will be displayed. Please allow 21 days to account change request to be reviewed and proceeded. If your request is successful and no additional information is required, your account will be updated. You will receive a letter from Health Insurance BC if additional information is required. Let's find out what is the best way to contact Health Insurance BC if you have any issues or questions. Contact Health Insurance BC about any issues or questions you have about enrolling in MSP, canceling coverage, or applying for supplementary benefits. There are three ways to contact Health Insurance BC: by phone, by mail, or by email. You will receive faster service by phoning Health Insurance BC during business hours indicated on the website. An automated service is also available 24 hours a day, 7 days a week, to provide general information about MSP benefits and services. By mail, please be aware that due to the high volume of inquiries, mail can take up to 21 business days from arrival to processing in addition to mailing time. Please do not resend your inquiry during this period. By email, use email for general inquiries only. Please do not email questions about your account or include any personal information. HIBC will not respond to emails of this nature due to their privacy and security standards. All contact details are provided at the official BC government website, BC Resident Contact Us page. Last but not least, on the following slide, you will discover general information about HealthLink BC, the products and services it offers, and the methods to explore them. HealthLink BC provides reliable non-emergency health information and advice in BC. Information and advice is available by telephone, website, a mobile app, and a collection of print resources. Through the HealthLink BC programs and services, you can get the information you need to make decisions for yourself and those you care for. With the website and telephone service, information is available wherever you want it, any time of the day or night, every day of the year. Products and services. HealthLink BC brought together some of BC's most trusted and recognized health information services. You may call HealthLink BC at 811 toll-free in BC. You will be connected with an English-speaking health services navigator who can provide health service information and connect you with dietitian, nursing, pharmacist, physical activity services. Translation services are available in more than 130 languages. Learn more about 811 at the website healthlinkbc.ca. This website provides medically approved information on more than 5,000 health topics and symptoms. It includes interactive health tools and tips for maintaining a healthy lifestyle. The website is optimized for many different types of devices. BC Health Service Locator app. HealthLink BC app helps you find walk-in clinics, hospital emergency rooms, urgent and primary care centers, immunization locators, pharmacies, and laboratory services near you. You can search for health services by city or keyword. The HealthLink BC directory lists health-related services provided by the provincial government, provincial health authorities, and non-profit agencies across the province. You can search for walk-in clinics, emergency rooms, hospitals, mental health programs, home care programs, pharmacy services, laboratory services, and so much more. The HealthLink BC files are easy to read fact sheets about public health and safety topics. The files are available on the website and in print at local public health units. All HealthLink BC files are available in English and translated into Chinese, Farsi, French, Korean, Punjabi, Spanish, and Vietnamese. For more information, please visit the website healthlinkbc.ca. In conclusion, it's vital to understand the details of healthcare and the medical service plan in British Columbia. Managing your MSP account and staying updated with any changes ensures that you maintain appropriate coverage. Additionally, exploring resources such as HealthLink BC can provide valuable information and support for your healthcare needs. By being proactive and informed, you can effectively navigate the healthcare system in BC and access the services you require. Thank you for your attention. I hope that the webinar provided valuable insights and useful information. I highly recommend registering with Planning for Canada to access additional pre-arrival support if you haven't already done so. Best wishes as you embark on your new journey to Canada.